good day everyone. This is Haname Salisa, and together with our group, we will be discussing one of the topic under learners with exceptionality. So, typically when we hear about physical disability, we really have an image in our mind, right? Like part of that image includes some aspect of the person's physical being that we can immediately see as a disability. And perhaps part of that image also include wheelchairs, crutches, or deformed limbs and unusual behavior. When we think about health disabilities, we cannot see an image of physical differences, but the first thought that comes into our mind is that that individual may be weak or frail, and that is something that we are going to discuss at this moment. We have to discuss further the physical and the health impairment. So let's begin our knowledge building by looking first at our learning objectives. So we have here our learning objectives. We have to describe what is physical impairments, and we have to identify the types of physical impairments and explain the causes, symptoms, and treatments and the implications of physical impairment to learning. So we have to read the terms. So the term physical and health disabilities are generic terms that cover the orthopedic impairment and other impairments, health disabilities, and so on and so forth that we will be discussing few minutes from now. So, specifically, physical and health disabilities, it involve the function of our muscles, our joints, our bones, and it can impact the child's ability, especially in school, the child's performance. Yes. And we have here the two types of physical disabilities. We have the neurological and the orthopedic. So in the neurological, we have here the central nervous system, since the central nervous system is really responsible to control other certain parts of the body. And if there's something wrong with your central nervous system, then there might be something wrong with how you move and how you feel. Yes, and we have here the orthopedic, the skeletal and the muscular system. So this skeletal and muscular system, this involves our joints, our bones, our limbs, our hands, and our feet. Those that involve skeletal and the bone system. So meaning these two, neurological and orthopedic, they are similar in terms of output. So this all impact movements and feelings. So there are two distinct and they are both separate types of the disabilities. However, they cause similar limitations, meaning they have similar output in terms of movement and feelings. So we have here the neurological impairment. So neurological impairment occurs when there is damage to the nervous system. As what I've mentioned earlier, like if there is something wrong with your nervous system, meaning it can damage the areas that your brain processes information and communicate with the rest of your body. Like for example, with your spinal cord, if your spinal cord is broken, meaning you are possibly can have a paralysis or may be partial or complete paralysis, since the spinal cord, it connects to the brain, so meaning it controls certain parts of your body. Next is we have here the example of neurological impairments. We have the cerebral palsy. It is a motor disability caused by brain dysfunction within the motor strip. So the motor strip, it is responsible for the large muscle and the movements of the forelimbs, our hands and our feet. Next is the epilepsy. It is a neurological disorder in which brain activity becomes abnormal. So here's the epilepsy. A child can really have seizures or periods of unusual behavior. And sometimes those who have this kind of impairments, they have sometimes loss of awareness. Next is spina bifida. This is a condition that affects the spine and is usually apparent at birth. So this spina bifida, it is possible that the child can have a partial or complete paralysis, meaning that child can hardly or have difficulty moving his or her limbs. Okay, we have here the physical symptoms of neurological problems. So we have the partial or complete paralysis. Then next is, as what I've said, mentioned earlier, paralysis meaning you can have difficulty moving your limbs. Next is muscle weakness. Muscle weakness meaning that individual or that child have difficulty moving his or her body because of weak muscles. Next is partial or complete loss of sensation. So this child have really sometimes loss of awareness, is not aware of everything that has happened around him or around her. So next is seizures. So these seizures, I know every one of us might be familiar with seizures. So these seizures, it is unusual behavior of that person nga naay neurological problems. So sometimes magani kay there are times when naay mo gawas nga salayba sa bata or sa kana nga tawo. So next is difficulty reading and writing. Since there's something wrong with the central nervous system for a fact that it controls certain parts of our body, so meaning maapektuhan pod ang iyang comprehension sa bata. And similar with the poor cognitive ability. So it would be difficult for the child to grasp information and to grasp learning since he or she has poor cognitive abilities. Next is unexplained pain. So those individual who have neurological problems have unexplained pain. Diba? The output of neurological impairment is in terms of movement and feeling. So they cannot hardly, they cannot explain the pain they are feeling because one fact is that there is something wrong with their central nervous system. Next is decreased alertness. So similar lang po ni siya sa partial or complete loss of sensation, which means that sometimes they have lost their awareness. Okay, next is the treatment. So naay treatment ang neurological problems. It means we have here the neurological rehabilitation or naay rehab. It is a doctor-supervised program designed for people with diseases, injury, or disorders of the nervous system. So it's really difficult for us to just self-diagnose, no? If we can see that our child have these symptoms mentioned, they have partial or especially this complete paralysis, we really have to ask for the doctor's help. Yes, because they are designed for people in terms of disorders in their nervous system. So next, the second type of physical disability is orthopedic impairment. So according to the Federal Individuals with Disabilities Education Act or IDEA, an orthopedic impairment is designed or defined as a bone, joint, or muscle-related disability. That is so severe that it negatively affects a child's educational performance. So orthopedic, it refers to our bones. Yes, it has something to do with our bones. Next is the cause. So these are the cause of orthopedic impairments: the amputation, the birth defects, disease, accidents, or hereditary. So we can see here in the picture that is a child with amputation. That child has no hands, wala na siya kamot, but it doesn't mean that that makes him less of a child. That only means that that child is special. Yes, birth defects and sometimes accidents, like, diba? We cannot really tell accidents kanus ang may tabo. That is why it can also be one of the cause of orthopedic impairments, like during an accident, unfortunately you lost your both hands or both feet, so that for a fact is a cause of orthopedic impairment. Next, this may be include paralysis also, as well as in orthopedic we also have paralysis, unsteady gait, poor muscle control, and the loss of limb, as well as impede speech production and the expressive language of the child. Yes, the loss of the limb, I have already mentioned that earlier. So we have here the treatments for those individual having orthopedic impairments. We have here the physical therapy, which helps the child develop stronger muscles. So through this physical therapy, the child works on skills such as walking, using the crutches, or sitting and keeping his or her balance. And yes, the doctors may assist or their parents may help during this physical therapy. Yes, it develops stronger muscles. Next is occupational therapy, which helps the child develop fine motor skills. So with this helps the child in developing his or her fine motor skills. These fine motor skills involve feeding, writing, and then other daily living tasks para ma-exercise ang ilahang fine motor skills. Next is speech language pathology. So this helps the child develop his or her communication skills, since one factor or one symptoms of orthopedic impairments is impede speech production. So meaning a child that has something to do with his speech, this can be treated with speech language pathology. It helps the child develop his or her communication skills, and the child may work in a particular on speaking, which may be difficult due to problems with muscle tone of the tongue and throat. So all of these are available as related services in both early intervention programs for very young children and special education for school-aged children. So I think that would be all. I will give the next discussion to our next presenter.
Good day, ladies and gentlemen. I am Jerome Doblas from BS Social Studies 2A. So for today's video, I am going to explain or to discuss my understanding about physical disabilities and learning outcomes. So let's start. So physical disabilities implications for learning. So the first bullet is the initial barrier experienced by many students with physical disabilities and physically accessing the learning environment itself. So the first one is ang unang hadlang daw ay isang nararanasan ng maraming estudyante na may physical na kapansanan ay ang physical na pag-access sa kapaligiran ng pag-aaral mismo. Para sa maraming mga mag-aaral na may mga physical na kapansanan, ang kawalan ng akses sa gusali at kapaligiran ng lugar ay isang problema. And it is one of the problem that many of the students are hard to access easily in accessing the infrastructure or the building that they can easily to get in. So the second is students with physical disabilities may have problems related to movement, posture, grasping objects, communication, eating, perception, reflex, movements, and or automatic motricity. Ang mga mag-aaral or ang mga students na may mga physical na kapansanan at mga kondisyon ay neurological ay maaari ding magkaroon ng mga problema sa pag-uunawa na maaari magkaroon at iba't ibang anyo. Ang ilang mag-aaral ay kahinahirapan sa aktwal o o pagtanggap ng impormasyon sa pamagitan ng pandinig o paningin. So the third one is students with physical disabilities and neurological conditions may also have perceptual difficulties that can take various forms. So the third one is ang mga mag-aaral na may kondisyon na neurological at maaaring mayroon ng kahirapan sa pagsasalita at wika kasama na ang mga mag-aaral na bingi o may bahagyang pandinig ay maaaring nahihirapan sa pakipag-usap sa pamagitan ng pagsasalita at pagtaong nakahirapan sa komunikasyon ay madalas na inisip na may mababang kaysa tunay na kakayahan nila. So the students who have physical disabilities, they are the conditions that they are difficult to understand or take the various forms in many ways. So the last one is that students with neurological conditions and who may also have physical disability may have speech and language difficulties along with the students who are deaf or who have partially hearing may have difficulty communicating through speech. So ang magkaroon ng maepekto ng pisikal na kapansanan sa ilan or lahat ng aktibidad sa mas malaki o mas maliit na lawak ay mga mag-aaral na pisikal na kapansanan maaring magkaroon ng problema or naugnay sa paggalaw, postura or pag-upo sa pagtayo at paghawak na pamagitan ng mga bagay komunikasyon. So the students and the students who have deaf, they are hard to understand the situation or to communicate easily to the normal students. They are hard to understand what is the meaning of that and what is the there are language difficulties. So the last one is, so this is my understanding about physical disabilities for learning. So it is important that to avoid making quick judgment about the students, to ensure that automatic assumptions are not being made concerning a student's intelligence and ability if their speech is very slurred, or if they are non-verbal. So mahalagang maiwasan ang mabilis na paghusga tungkol sa mga mag-aaral na ito upang matiyak na ang mga otomatikong pagpalagay ay hindi ginawa tungkol sa kalimutan at kakayahan ng isang mag-aaral kung ang kanilang pananalita ay nakapagpabagal o malabo kung sila ay hindi pagsalita. Ang potensyal ng mga pag-aaral na ito ay madalas hindi nakilala na naobserbahan ni Berry at Romini ng mga mag-aaral na may physical na kapansanan ay nag-uulat na ang suporta mula sa post-secondary ng mga guro at kawani kasama ng kapaligiran at matagal suporta sa mahalaga para sa kanilang post-secondary na pag-aaral. So this physical disabilities, they undergo the research, or they are undergo the research so that the students who have physical disabilities may have easily access to the things that the normal students who have a complete or normal, they are easily to access. And somehow let's appreciate the students who have disabilities today. And for that, and that could be all. Thank you.
So, hi. So today I am gonna explain health impairments. So, the learning objectives. So first is describe what is health impairments. Identify and explain the types of health impairments. Provide the characteristics, symptoms, and causes of each type of health impairments. Educational strategies and treatments. And enumerate some institutions that help people with health impairments. Health impairment. So, a chronic or acute health problem such that this physiological capacity to function is significantly limited or impaired and results in one or more of the following: limited strength, vitality, or alertness, including a heightened alertness to environmental stimuli, resulting in limited alertness with respect to the educational environment. So, we say chronic or acute means these are like critical or impairments or problems that includes your body said, which means it is vital and it is very important to know this diseases or health problems as soon as possible. So chronic condition, so develops slowly and has long time symptoms. So this is a long term diseases. It develops slowly means hinay siya nga murag mulala or mo-develop, and non long lasting, which means it lasted for years. Next is acute condition, develops quickly and symptoms are intense but last for relatively short period of time. Acute means kalit ka ng kalit, which means that diha dayon ning gawas ang symptoms, and dali ra nga ning critical or dali ra nga maklaro ang sakit. So here are the different health impairments. So attention deficit hyperactivity disorder or ADHD, diabetes, epilepsy, hemophilia, leukemia, nephritis, rheumatic fever, Tourette syndrome, anemia, and there are a lot more. So first, I'm gonna explain the attention deficit hyperactivity disorder, so ADHD. So is a condition that can make it hard for a person to sit still, control behavior, and pay attention. These difficulties usually begin before the person is 7 years old. However, these behaviors may not be noticed until the child is older. So, this can be an example of a chronic condition because it's long term, which means dugay nimo siya nga makitaan or dugay nimo siya nga mabantayan. So, ADHD kanang maglisod ka o lingkod nga magpuyo ra, di ka kontrol sa imong sa mabuhaton, di maglisod ka og focus. So the three main symptoms or signs of ADHD, so acting before thinking, called impulsivity, which means kanang buhaton nimo sa una sa nimo sa kanang magmura basta mabuhat ka nga walay una na problems with paying attention, kanang dili bitaw maminaw niya. Being called very active, called hyperactivity. So kanang kiat kayo siya. That is the main symptoms. The etiology, so the causes of ADHD is unknown and still very heavily researched. So most researchers agree that it is an interaction between genetic and environmental factors. As in the case with most psychiatric disorders, some cases of ADHD are related to previous infectious or neurological trauma. So, ADHD is still in continuous research by our scientists. So, most of us kind of genetic, which means na-inherit ni mo, means naman na. Environmental factors means naapektuhan ka sa imong palibot. So, mo na yung mga environmental factors. So environmental factors, ingestion of alcohol or tobacco during pregnancy can affect central nervous system development and can increase the risk of offspring developing the disorder. So, kanang ligog tabako bitaw while nagbuntis pa ka sa imong mama, nang hilig og inom, so that can also increase the risk of getting this disorder. So ADHD has also been linked to excessive television watching at an early age. So kanang mga bata nga sige tanaw TV, muni kasagaran nga more likely nga way hinungdan nga nga magka-ADHD ang isa ka bata. Individuals with ADHD exhibit combinations of the following behaviors. So, shifting from one unfinished activity to another. So, kanang, dili niyo manon bitaw ang isang kabutang, kanang, gikan siya nagduwa, gikan siya nagkaon, then muditso siya og duwa ditso. Nya, duwa, bubalik na sa siya tuglain. Kanang, dili bitaw mahimutang, dili mahimutang na siya. So, failing to give close attention to details and avoiding careless mistakes. Kanang, muna sila ang kanang, mura bitaw sila, murag madanghag sila bitaw. Murag wala sila ipake, mga inana. So, losing things necessary for tasks or activities. So, muna sila, mahimo silang madanghag sila, takatarag butang sa ilang mga gamit. Difficulty in listening to others without being distracted or interrupting kanang bitang dili kanang magstoryahan nimo pero dili maminaw. So wide ranges of mood swings and great difficulty in delaying gratification. So treatment. So ADHD management usually involves some combination of therapy, medication, and deliberately lifestyle change. So there are therapies to treat ADHD nowadays. So common medication includes psychostimulants and some antidepressants. However, medicating children is a controversial issue because of drugs' ability to interfere with normal development. So some drugs kay maka-affect jud sa ilahang growth or sa ilahang mental health. That is why nga dili kayo siya i-publicized. So diabetes is a known disorder or a disease, so in which the body does not produce or use insulin properly. So insulin is the hormones of our body used to convert sugar, starches, and other food into the energy we need. So if kuwang ka og insulin sa imong lawas, which means mo taas ang imong sugar level. While the cause of diabetes is unknown, it appears that both genetics and environmental factors such as obesity and lack of exercise play roles. So genetics, which means mamana nimo, which means diabetes imong papa, na ay possibility nga mamana nimo. Environmental factors anang makapekto sa ang imong palibot kung sa imong palibot. Obesity kanang sobraan ra kagkatambok as in you're in an abnormal level of an abnormal weight. Several types of diabetes. So there are types of diabetes. Type 1, when a person's body produces too little insulin. So imong body gamay ra produce ng insulin, daw is type 1 diabetes. So type 2 diabetes, the most common type of diabetes, develops because a person is insulin resistant, which mean dili mong stay ang insulin sa imong lawas, dili ka sustain. Gestational diabetes develops during pregnancy and can lead to very high and dangerous blood sugar levels. So during pregnancy, while nagbuntis ka, you are very vulnerable to diabetes. Diabetes increases a person's risk of developing type 2 diabetes. So some diabetes symptoms are going to the bathroom frequently, o kana magsik-ihi, gibusaw, manalang gingon, lots of thirst, pero hawon, extreme hunger, weight loss, more fatigue, irritability, dili mahiluna, blurry vision, mahanap-hanap ang mata. So that is all.
Hello everyone, good day. I am Kyle Biliko from BSL Soxtad 2, and I will be the one to continue discussing about the different types of health impairments. So the next one is epilepsy. So epilepsy is a seizure disorder. So when we say seizure, it is a sudden attack or abnormal discharge in the brain. According to the Epilepsy Foundation of America, a seizure happens when a brief, strong surge of electrical activity affects part or all of the brain. So seizures can last from a few seconds to a few minutes. So kanis siyang seizure, there is a electrical activity nga mahitabo sa imong brain. So kung unsay, di ba, ang atong brain controls our body. So kung unsay mahitabo sa atong brain, it reflects in our body. Like if there is an electrical activity nga mahitabo sa brain, mo affect siya sa body, and ang effect na niya is kanang bitong mangurog ta, kanang magkurug-kurug ta nga na tungod na siya sa activities nga naa sa atong brain. They can have different symptoms. From convulsions, so when we say convulsions, it is an abnormal or violent and involuntary contraction of muscles or series of contraction of the muscles. Kanang makatag mo yun nga, halagi convulsion siya. Kanang mukalit tag pangurog, usa po na siya, kanang mukalit og pangurog. Then loss of consciousness, kanang makuyapan ka, kanang mawad-an kag panimuot. Then to signs such as blank staring or kanang matulala lang ka og galit without any reason, kanang mukatra kag na magtulala lang ka, or lip smacking, kanang gani ka, or jerking movements sa arms and legs. So when I say jerking movements, kanang mukalit rag gani ang imuhang arms or ang imong legs, mukalit ra jag lihok nga wala nimo gi-control. So although the symptoms listed below does not necessarily mean that a person has epilepsy, it is wise to consult a doctor if you or a member of your family experiences one or more of them. So ang mga symptoms sa epilepsy is blackouts. So mo na po niya hong gi-explain ganina. Blackouts are mawad-an lang kag pananaw or mag-black lang imong pananaw, or periods of confused memory. The next is episodes of staring or unexplained periods of unresponsiveness. Kanang matulala kang magnara kag fokusan nga usa ka butang or naay isud sa imo na huna nga murag paminaw nimong ana ra jud ka mag-focus, then murag out na ka sa real world or naa na ka sa laing dimension. Paminaw nimo naa na ka sa laing dimension kay naa kay laing ginahuna, and kato mga tawo nga naa sa duol nimo murag di na nimo sila madungog, wala na ka unresponsive na ka kay wala na ka sa real world. Wala nimo sila nadunggan, wala nimo sila nabantayan. Usa na sa mga symptoms sa epilepsy. The next is involuntary movements of arms and legs. Mo lagi to nga mukalit raglihok ang imong arms and legs. The next is fainting spells with incontinence or followed by excessive fatigue. Mo aning mga mukalit ra kag katumba tungod sa kakapoy. The next is odd sounds. Nakay madungog nga mga odd sounds nga wala na dungog sa uban. Nga kanang ikaw ray nakadungog. Then distorted perceptions or episodic feelings of fear that cannot be explained. So some people can have a seizure and yet cannot have epilepsy. So naiuban nga maka-experience silang ani nga symptoms, which is mga simptomas ni sa naa kay seizure pero wala kay epilepsy. Like for example, many young children have convulsions from fevers. So ang kasagaran sa mga bata kanang maka-experience og convulsion sa fever. Then other types of seizures not classified as epilepsy include those caused by an imbalance of body fluids or chemicals or by alcohol or drug withdrawal. Usa sad na mga seizure na siya pero dili jud siya ma-classify as epilepsy. So thus, a single seizure does not mean that the person has epilepsy. Like for example, naka-experience ka sa usa ani nila nga mga symptoms. That means na kay seizure. But if maka-experience kag more than 2 nila or 2 or more, then that means nga na kay epilepsy. But it is much better na mo-consult ka sa doktor kay ang doktor may mas nakahibaw kung unsay imuhang sakit. Diba? So na, generally speaking, the diagnosis of epilepsy is made when a person has 2 or more unprovoked seizures. So the next one is hemophilia. So hemophilia is a rare and inherited disorder in which your blood doesn't clot properly. So as a result, people with hemophilia may bleed after an injury for a longer time than those without disorder. Bleeding can also be internal, especially in the knees, ankles, and elbows. So when we say hemophilia, it has delayed clotting of blood with prolonged or excessive internal or external bleeding after injury. Kada bang mag-bleed sila nga dugay, there are also some instances nga mag-bleed sila internally na sa sud. So the disorder occurs when a person is born without the protein, sasad ni, or with too little of it or too little of protein that causes blood to clot. So when we say clot, when we say blood clot, it is a clump of blood that has changed from a liquid to a gel-like or semi-solid state. Kada bang manggahi na nga dugo. So with a very few exceptions, this disorder usually occurs only in males. Kasagaran rin kaning hemophilia kasagaran sa mga laki. However, it is a myth that persons with bleeding disorders such as hemophilia bleed to death from even minor injuries. So in truth, the conditions ranges from mild to bleeding. So here are the symptoms of hemophilia. It includes excessive bleeding. Moto magsigig ra siya ka-bleed or dugay maulian ang iyang samad. The next is excessive bruising, kani mga samad-samad ra, kani mga sagman nga ginagmay, mga bruise, mga gas-gas. Then easy bleeding, dali ra masamad. Next is nose bleeding, kani mga tag gisong guta. Then abnormal menstrual bleeding. So sa girls ni. So the next one is leukemia. So leukemia is a cancer of the blood and bone marrow. So may cancer sa atong dugo ug sa atong bone marrow. As with many other health impairments, leukemia's symptoms are similar to those of other more common illnesses. So the signs also vary depending on the type of leukemia. So leukemia is also an acute or chronic disease in humans and other warm-blooded animals, characterized by an abnormal increase in the number of white blood cells and tissues and often in blood. Muna sila, muna yung mga tao nga ay leukemia. So all the type most common in children has the following symptoms according to the Leukemia and Lymphoma Society. So first is the tiredness or no energy. Kanang why energy, kanang dali ra kapuyon. The next is shortness of breath during physical activity. Dali ra mawadan og hangin og kanang magsige sila engage in physical activities, kanang mga recreational activities such as kanang mga pakusog bitaw kanang para sa atong body. Muna siya. Then pale skin. O maklaro na nimo sa usa ka tawo kung pale siya og skin kay mamuti, wala di kayo red ang iyahang panit. The next is mild fever or night sweats. Then slow healing of cuts and excess bleeding. Otong dugay maulian ang iyang samad ug magsigi ra siya og bleed. The next is black and blue marks or bruises for no clear reason. Kaya batong naiuban maka-experience anang kanang naay mukalitra o gawas nga pasa sa atong lawas. Kasagaran ang kay violet og color, di ba? Kasagaran mo gawas nga pasa. Kanang mabantayan nimo hindi mata nimo na nakay mga pasa-pasa. Kasagaran violet og color. But ang sa leukemia is black and blue marks or bruises. So why no reason. So the next one is pinhead size red spots under the skin. The next is aches in bones and joints. Like for example, in the knees, hips, or shoulders. So magsakit ang imuhang bones kay affected man to siya nga part. Then the next one is low white cells counts. So the next type of health impairment is nephritis. So nephritis means that one or both of person's kidneys are inflamed. So It is caused by infection, degenerative processes, or vascular disease. So mo nang kamita mo ingon og nadaot ang imong kidney. Nadaot or inflamed, or there is something wrong with your kidney. Then the kidneys are very important organs in the body because they clean the blood by filtering out excess water, salt, and waste products from the food we eat. So healthy kidneys keep protein in the blood, which in turn helps our bodies soak up water from the tissue inside. However, damaged kidneys can leak protein into the urine, which affects the ability of the body to absorb water from our tissues. And this causes the tissues to swell. So, kanang uban bitaw nga, kanang maingog, nadaot ang iyang kidney, ang usa ka kidney na daot na. So, kung bisan ganig usa na ka kidney na daot, naanay lain nga may tabo sa imong lawas. How much more kung ang duha ka kidney ang daot? So, ang kidney may mo filter sa mga waste sa atong lawas. And if wala tay kidney, kinsa na may mo filter adto nga mga daotan nga wala na. And kasagaran sa mga wala na kidneys kay they are prone to death. Sa uban siguro nga magamit og mga machines para maayo ang kidneys, or ay uban nga mag kidney transplant. Kay ang kidneys is very important good in the organs in our body. So you may also hear the term nephrotic syndrome used. So both children and adults can have nephrotic syndrome. In itself, it is not a disease, but may be the first signs of kidney disease that impairs the body's ability to produce urine. Wanang kanang, if ang imong urine lahi og color, like di ba ang normal nga color sa urine is yellow, or more on like light yellow. So if ang color sa is murag dark na nga yellow, or yellow orange na, or ang uban gani is color red na, or orange, from orange to red, kana maingana nga mga urine, there is something wrong with your kidney. Naanay something wrong sa imong kidney and need na ka mudong og doktor. Kay kung dili maagapan, maguba ang imong kidney, tangtangon nila imong kidney, asa ba magka-kidney? So, wala na. So, in children, nephrotic syndrome is most common between the ages of 1.5 and 5 years, and seems to affect boys more than girls. So, kabantay mo, no? Kasagaran ani mga health impairments, kasagaran ani mga diseases or illnesses sa health is boys are prone. Kasagaran kay mga laki ang maigo. Ang amagod kay kaning mga laki kay pabaya sa ilang lawas. Kanang uban nga magsigirag. Usa sad sa kana makadaot sa lawas kay kanang magsigi kag inom alcohol. Kanang alcohol makadaot gyud sa lawas ug kanang sigisigihan gyud ba. Then kana sang smoking, of course, sa lungs, diretso dayon sa lungs. Unsa naman kung madaot imong lungs, then kanang mga vape o sa kanang smoking, kanang vape, and counted sa ang drugs kay it also affects our brain. Kanang makabatik ang drugs kay murag, although it can boost your brain, kay naiuban nga mga drugs kay gamito nila para for good memory, especially na uban nga murag mag-take og exam, kanang lisod na nga exam, so naiuban nga maggamit og drugs kay para ang ilahang mga gipangtun-an masud sa brain dili makalimtan. So it can boost our memory. Then pero ang drugs naa say side effects, no, kay ang drugs kay murag it can make people hallucinate. So mag-hallucinate sila nga naa sila makitaan nga butang nga wa ta kakita, naa say uban nga makadungog og mga sounds nga wala ta kadungog. may ingana ba nga mga panghitabo. And ang uban is mga buang na, mabuang tungod sa drugs. Pagdaot ang utok tungod sa drugs. So, highly discouraged ka ng mga ingana nga mga kuano. So, dapat be a normal human being nga dili ta mo engage og mga ingana nga mga butang nga makadaot ra jud sa atong lawas. Then, here are the symptoms in children sa nephritis. It includes high levels protein in the blood or paradoxically low levels. Then, swelling when salt and water build up in the tissues. Then, mga less frequent urination. Yan, ang tagsara ka magsigig pangihi. Kay kaning, ang sakto nga pagpangihi sa kataw sa kadlaw is 5 times or more than 5 times or taas pa na. So, if tagsara gani ka mangihi, there is something wrong with your kidney na. Mo tong sa honggi ingon nga if lahig color ang imuhang urine, nanay something wrong sa imong kidney. The next is weight gain from water retention. The next is rheumatic fever. So rheumatic fever can develop as a complication of untreated or poorly treated strep throat. So when we say strep throat, it is an inflammatory sore throat. Or scarlet fever. So ang scarlet fever, contagious fibrate disease characterized by inflammation also of the nose, throat, and mouth, or generalized toxemia and red rash. So while it is most often seen in children from 5 to 15, younger children and adults can also contract rheumatic fever. So ang kaning rheumatic fever, taas pa ni siya sa normal nga fevers kay nabilong man siya sa mga health impairments na nasa sa higher nga level sa fever. Mo to in the definition kanang mga complications sa untreated or poorly treated nga strep throat, kanang wala na mao pag-treat or there is a complication sa nga dili ka magpa-treat sa ana nga fever. So it can lead to rheumatic fever. So symptoms in children include fever, of course. The next is pain in one joint that migrates to another joint. So kung naa kay sakit sa usa ka joint, then mobalhin sa another joint, then usa sa symptoms sa rheumatic fever. The next is red, hot, or swollen joints. Then small, painless noodles beneath the skin. When we say noodles, it is a swelling on a leguminous root that contain symbiotic bacteria. Muna siya ang noodles. Then next is rapid or fluttering or pounding heartbeats or palpitations. Kanang mga irregular beatings na bitaw sa heart. Muna siya. Usas siya na sa symptoms. Then fatigue. Then shortness of breath. Then a painless rash with a ragged edge. Then jerky, uncontrollable body movements, most often in the hands, feet, or face. Kanang mga di na to makontrol nga movements or mga unnecessary movements nga di na to mabantayan or mabantayan pero di na to makontrol. Like mo jerk lang sila kanang hand niya mga mukalit lang og something mga ingani-ingana or kanang tiil nimo nga mukalit lang og kalihok, gawa nimo lihok ka, or kanang mga unnecessary movements sa imong face. Then unusual behavior such as crying or inappropriate laughing. So ang uban ani no og maka-experience ani mga unusual behavior such as crying or inappropriate laughing. Ingnan kanila nga na kay sakit sa panghuna-huna. So usa na siya sa symptoms sa rheumatic fever. So the next one is a Tourette syndrome. So most of the people already knew what is Tourette syndrome. So ako, nakaibaw ko ani kay dugay ako nakahibaw ani kay say na makita na siya na sa YouTube or sa TikTok then ay mga tao nga na ay Tourette syndrome. So kanang mga TikTokers is to kanang give awareness to other people nga naay mga tao nga ingana kay naa mo uban nga wala sila kahibaw nga kadtong tawhana na ay Tourette syndrome and katawan ra nila kay ang tao nga naay Tourette syndrome is maka-create sad og kanang mga repeated movements nga di sa nila makontrol or unnecessary movements. So let's have the definition for Tourette syndrome. So it is a neurobiological disorder characterized by tics. So when we say tics, it is an involuntary characterized by tics. So tics is an involuntary, rapid or sudden movements and or vocal outburst that occur repeatedly. So yan ay mga sudden twitches, mga movements or sounds. So naatay duha ka types sa tics, motor o vocal. So may say motor sa body na, then vocal through vocally. So mga motor tics kana mo kalitrag kuan na i-demonstrate na ho. Mga motor tics like for example, mukalit lang og ingana may kasagaran ni baon mo ingana or mga ingana or kamot or mga part sa body nga mukalit lang lihok nga mo repeat. Then ang vocal tics kana maingon sa ho apo nakitaan kana mo na mga ingana. Kung makabantay mo mga tao nga magsigig ingana, please do not make fun of them because they are experiencing a very rare syndrome. Yes, rare ang Tourette syndrome. Out of 10, usaray maka-experience og Tourette syndrome. Kay rare na dyan siya. Tagsara ang naay Tourette syndrome. So kung makakita gani mo ingana mga tao, please do respect them and you must know how to approach or to help if naa man gani mga instances nga mag-need sila og help nimo. And nasa uban nga tao nga naay Tourette syndrome nga nagtrabaho in order to sustain the basic needs of his family. So na ako nakitaan ko siya taxi driver, then naa siya Tourette syndrome. Kanang sa Manila man siguro ni Tourette syndrome then kana bitang mo text ra ka or mo tawag ra ka then kuhaon na ka sa taxi ana nga lugar then pagsud sa mga tao nakabantay man sila nga naay mga unnecessary movements or repeated movements ang gihimo sa driver. So nakubaan ang mga passengers kay what if mabangga sila kamo ingana magkalit ang driver or something ng mga ingana. So kuba luoy kaayo ang mga tao nga ingani nga kanang naa sila sa ordinary class nga naay Tourette syndrome kay dili sila makaduwang sa ospital to treat their disease kay mahal gyud ang bayad. Although wa pa may ka-research if there is a treatment for Tourette syndrome, but naay medicine nga maka-prevent sa tics nga mahitabo. So let's continue. It is an inherited neurological disorder that is first noticed in childhood, usually between the ages of 7 and 10. The syndrome is 4 times as likely to occur in boys as in girls. So may inherit ni siya from our mother, from the mother, then makita ang symptoms ani at the age of 7 and 10. If you have a Tourette syndrome, go to the neurologist. Then ani mag-recommend at sila muhatag silang medicine to prevent the tics from occurring. So they will test your brain kay brain neurological man jud sa brain is siya nga kuan. Kay our body parts is controlled by our brain. The next we have anemia. So anemia, it is a common disease Kay kasagaran sa mga tao kay anemic. Naing moingon na anemic man ka, which means gamay kag red blood cells, gamay kag dugo. So anemia in general is a condition where an individual's blood has less than a normal number of red blood cells, or the red blood cells themselves don't have enough hemoglobin. Hemoglobin, which carries oxygen throughout the body. So we also have sickle cell anemia. So it is one type of anemia where the hemoglobin is abnormal, and the red blood cells often became shaped like the letter C. So ang mga red blood cells mag-shape into letter C, making them sickle-shaped. So mani ang sickle cell anemia, usa ni sa type of anemia nga ang hemoglobin is abnormal. So when we say anemia, it has low hemoglobin that can make you feel tired and weak. Dali ra kakapuyon imong lawas, dali ra kakapuyon. So the three main reasons why people became anemic is the blood loss, a reduction in the body's ability to produce new red blood cells, or illness that leads to the increased destruction of red blood cells. So ang treatment aning anemia is kanang mga iron nga mga foods. So mga iron supplements or foods that are high in iron. So here are the symptoms of anemia. So we have fatigue, weakness, pale or yellowish skin, irregular heartbeats, shortness of breath, dizziness or lightheadedness, chest pain, and cold hands and feet. Wait lang, balita. So we also have other types of health impairments. So first is asthma. So what is asthma? In Bisaya, asthma is called hubak. Daghan na sila mga tao ngayon, magsigig kahubak, kanang maglisod og ginhawa, magsigig ubo-ubo, mo na siya hubak. So it is the most common chronic illness, a lung disease that causes episodes of extreme difficulty in breathing. So the next one is HIV and AIDS. So when we say HIV, it stands for Human Immunodeficiency Virus, and ang AIDS is Acquired Immune Deficiency Syndrome. So we are very familiar with HIV/AIDS since sa eskwelahan nato kay ilaman naaman tay HIV/AIDS awareness during our high school years. Mga visitors yung mukat lang ugdong sa eskwelahan, then ay mga ngani nga mga awareness or different diseases para ma-aware ta kung unsa to nga mga sakit, and makibawat ta kung unsaon on how to prevent those diseases, or if naa na kay nga na disease, on how to cure. So ang HIV, it is a virus that can take over a cell's own genetic material and then produce more diseased cells. Then ang AIDS, a collection of illnesses, including some cancers that only individuals who have HIV can contract. Then ang next one is cancer. So kaning cancer mo ni ang broad term sa mga diseases, and nasodan ni siya ito nga mga leukemia, ito na cancer sa blood. Mali ang definition sa naa sa PowerPoint. So ang cancer, it is an uncontrolled division of abnormal cells. It is relatively rare among children. Kasagaran sa mga like for example, cancer. May tag brain cancer. Nasa may uban og breast cancer, bone cancer, and etc. Daghan og cancer, pero common ang cancer sa mga adults, tagsara sa mga bata, and hadlok sa ding cancer no kay makamatay gyud. Naay uban nga mga cancer nga pwede ma-treat if sayo pa kay diba ang cancer kay na ay stage 1 or stage 1 nga cancer, stage 2, ang kanang stage 1 murag madada pa siguro nag-treat, and stage 2 if about nag stage 3 or 4 mga extreme na nga medicines ang gamiton na nila or di ang uban di na gyud matreat. The next is burns. It is a damage to your body's tissues caused by heat, chemicals, electricity, and sunlight or radiation. So another kind sa burns is through internal burns or inhalation injury caused by breathing smoke. So kaning types sa mga internal burns is kanang mga smoke, like what I have said earlier, kanang smoke or alcohol. Nga kanang alcohol kay if imo nang pasigaan kay musiga ba yan siya no, from the word itself alcohol. If masud ang alcohol sa ato ang body, there's a possibility if madaghan na gid siya, it will burn the body's tissues. So sa external burn, naatay first degree, second degree, and third degree burns. Then the last one is lead poisoning. So it occurs when lead builds up in the body, often cover a period of months or years. So the next one is the institutions that helps children who has health impairment. Mao ni ang mga institutions nga mag-help sa mga tao nga naay health impairments. Kato mga health impairments nga among i-discuss earlier. So, ang broad term niya ni is medical home. So, the term medical home is not a house, office, or hospital, but rather an approach to providing comprehensive primary care to the people who have health impairments. So, it is an approach to delivering primary healthcare through a team partnership that ensures healthcare services are provided in high quality, cost-effective, and comprehensive manner. So, una sa mga medical homes is mga personal physician, mga physician-directed medical practice, mga whole person orientation, coordinated care, and etc. Maura ni siya ang some ng mga institutions nga mag-help sa mga people with health impairments. Daghan pa gid ni siya but gamay ra among gi-include. So ang first is the National Center for Environmental Health. So or the NCEH. So it works to prevent illnesses, disability, and death from interactions between people and the environment. Naasad ni siya website which provides informations and resources for people with asthma. Di ka na asthma kay makuha raman nato kanang sakita makuha nato sa environment kanang mga abog-abog or mga chemicals usa na siya sa makapa-cause sa asthma. Okay, Centers for Disease and Control Prevention or CDC. So it is one of the 13 major operating components of the Department of Health and Human Services. So, ang kanina nga mga institutions all over the world na ninamo nga gikuha. So, which is the principal agency in the United States government for protecting the health and safety of all Americans and for providing essential human services. Kana bitong kasagaran sa mga health impairments, parang tagsa raman ata mo naka-experience nga Pinoy, kay mostly ang mga people from other countries ang naka-experience og mga rare disease. Then, next is the children and adults with attention deficit or hyperactivity disorder, puto mga ADHD. So, ang tawag aning institution is CHADD. It is a national non-profit organization working to improve the lives of people with attention deficit or hyperactivity disorder through education, advocacy, and support. The next is the National Attention Deficit Disorder Association. So, apil sa siya sa mga ADHD. So, it provides information, resources, and networking opportunities to help adults and children with attention deficit or hyperactivity disorder that leads them to better lives. Then, ang sunod is the National Diabetes Information Clearinghouse, or the NDIC. So it is an information dissemination service of the National Institute of Diabetes and Digestive and Kidney Diseases, or NIDDK. So NIDC was established to increase knowledge and understanding about diabetes among patients, healthcare professionals, and the general public. Then next is Epilepsy Foundation. So ang Epilepsy Foundation ensure that people with seizures are unable to participate in all life experiences and will prevent, control, and cure epilepsy through research, education, advocacy, and services. Then next is the Medline Plus. So together with the authoritative information from the National Library of Medicine, the National Institutes of Health, and other government agencies and health-related organizations. So this is also a website that provides information and resources for people with hemophilia. Then, ang sunod is the National Hemophilia Foundation. So, it is dedicated to finding better treatments and cures for bleeding and clotting disorders, and to preventing the complications of these disorders through education, advocacy, and research. So, usaray aim aning institution no to help people with health impairments, to give them better life, to treat, to prevent, to educate, and to advocate. Then, next is American Sickle Cell Anemia Association. It is an organization that provides quality and comprehensive services through diagnostic testing, evaluation, counseling, and supportive services to individuals and families at risk for sickle cell disease. The last institution is the Tourette Syndrome Association. It is to identify the cause of, find the cure for, and control the effects of Tourette syndrome. So this is also a website that offers resources and referrals to help people and their families cope with problems that occur with Tourette syndrome. So more to siya no, here are the references of our discussion. So more to siya ang mga health impairments, mga different types of health impairments, and the treatments, the characteristics of each, and the symptoms. And what are the institutions that can help those people who have health impairments? So we have clearly emphasized in the learning objectives, no? And katong mga learning objectives on answer to nato tanan. What are the types? What are the characteristics, symptoms, and causes? And the treatments and the institutions that can help those people who have health impairments. So that is all for our discussion about the physical disabilities and health impairments. So mo to siya tanan mo discussion, and I hope na naka-learn mo on what is physical disabilities, what are the types of physical disabilities, and also with the health impairments. So unsay mga characteristics, mga causes, symptoms, and treatments nga pwede ninyo ma-apply if there is someone or mga family related ninyo nga naka-experience og ingani nga disease or illness. So I hope that you have gained knowledge and learnings sa amo ang discussion, and I hope that you will apply it in real life situation if naaman gani. That is all for our discussion. Thank you so much everyone for lending your ears, and have a good day. Keep safe. Goodbye.